else is. It's always, I think, important to make sure that we try and be as succinct as possible, and lawyers like to waffle like I'm doing now. But certainly when we're talking about privacy and why it's important, effectively, if you handle information that can identify someone, you have to make sure that you collect, store, use, and share it safely and properly. Particularly in the health industry, there's an increased onus on medical practices and medical practitioners to make sure that you're all using information correctly. And it can be one of those often forgotten or overlooked areas that people don't like to think about and don't like to talk about. But we've seen some horror stories, both on my side of things as well as on Trace's side of things as well. So it's very easy to take appropriate steps to make sure you're doing it all properly. You're all doing the right thing by listening to this now. But just make sure you take the time to ensure that you're doing everything that you absolutely can to protect the personal information you deal with on a daily basis. I say it's incredibly important when we're talking about cybersecurity and just making sure that we're being very conscious of avoiding scams and other information, that we're protecting private personal information as much as we possibly can. So hopefully we all have an awareness that what we're collecting is incredibly sensitive information. So you're getting patients' names, addresses, dates of birth, Medicare details. You're getting potentially their religious beliefs as well, subject to where they may be, as well as various other matters. So by very nature of your medical practices on a day-to-day basis, you're privy to so much information that is absolute gold to hackers and people that are trying to scam you and your patients. So you need to make sure that you're doing everything you possibly can to protect that information. When we're looking at some steps that you should be taking, ASIC being ASIC, not only do they like to regulate and moderate and make sure we're all doing the right thing, they occasionally like to help us out as well. And what they've done here is they've given us some principles for good practice. So these are just some very general principles that we should all be mindful of in our day-to-day. Certainly, I'm sure you all have privacy policies on your websites. Hopefully you all do. Hopefully you all have privacy policies that patients sign when they come to the practice authorizing the collection. Hopefully you also have policies and procedures in place with your staff and with the doctors that clarifies exactly what to do if they become aware of something that's a little bit awry. So if they open that email that they potentially shouldn't have opened, or they click on that link they shouldn't have opened, if they potentially process a request from one of the doctors that's screamingly urgent without talking to them, and it turns out that that request wasn't legitimately from that doctor, it was actually from someone impersonating them, what steps do you have in place to try and mitigate that risk? What we want to see generally is having a really clear policy and procedure manual that outlines exactly what those steps are and exactly what those policies are in practice, so that you can ensure you've got that really clearly outlined. Not only is that helpful for your staff and for the doctors, but it's also really helpful if you ever do have to explain what steps you've done and how you've tried to mitigate that risk and that potential loss. It's incredibly important. Hopefully as well, there should be a general awareness nowadays of potential cyber issues. But also maybe making sure that you do regular or semi-regular privacy and cybersecurity training with your teams. So whether that's facilitated online or whether that's in person, but taking the staff through exactly some of the, in sometimes screamingly obvious things, like don't have the same password for every single account and don't have the password of password. But also other aspects of, oh, well, if one of the doctors sends an email to the practice manager saying, "Hi X, my bank account details have changed this pay period. Can you please make sure that you pay it to my new account?" And practice managers, being practice managers who are always madly inundated with too much work, get busy and they just process it because they don't have time to talk to the doctor, or the doctor's too busy to try and talk to. Hopefully have some measures and protocols in place to try and mitigate those sorts of risks, but also in terms of when you're dealing with patient records. So because they are so incredibly important and so very sensitive, making sure that you confirm with patients before you go transferring their personal information or providing their data to someone who's purporting to request it. Certainly circumstances will vary in terms of what confirmations you need, but if you have a patient that says, "Hey, can you please send me through my patient records at least hopefully make a confirmation with a phone call potentially or an email to that patient confirming where they want those details to be sent to, and hopefully confirming with a previously verified phone number potentially, or email account, just to make sure that you are doing everything that you possibly can to make sure you're sharing that information to the desired person. Effectively, why we're so worried about this and why we're trying to raise some greater awareness around the cybersecurity concerns is it's a potential goldmine for hackers, but it's also a potential massive cost to every single practice that might fall awry. So we know that the Australian government's looking to increase the onus on medical practices as well as all other individuals and corporates with how you deal with your personal information and the personal information of others. So there's already some fairly significant penalties, as you can see there, for practices potentially, as well as for individuals. I dare say that a $2.5 million fine would be quite expensive. So we want to make sure that we're trying to reduce that risk as much as we possibly can.
Also, ja, es ist halt so, wie ich vermutet habe, ne? Also man sieht, man kann das noch sehen, die Fruchthöhle und auch den Dottersack. Und,
so in terms of the reasons why and some recent examples, I'm sure we've all probably heard of Ticketek and HL Lebsworth and Medibank and Optus and a few of the other providers who have had those cyber breaches and those data breaches as well. We want to make sure that we're very cognizant of what's happening and we're potentially trying to avoid becoming one of those other businesses. I know the MediSecure hack where they lost all that information certainly made it very apparent for a lot of people why you want to be really confident that the information you're using is exactly correct, and that you're not potentially sharing anything that you shouldn't be sharing, but also so that you're protecting everything that you possibly can and taking as many steps to protect it as you possibly can. I said some potential considerations for what you can do to try and protect the information. Certainly make sure that you have measures in place for the secure storage of the personal information. One of my horror stories is going into a practice that said, oh, it's all right, we'll never have to worry about any cyber threats or data breaches or anything like that because we have this very nice old school server that has literal hard drives that you plug in and the practice manager takes home every day. Now, the problem with that is that they weren't necessarily checking that that server was backing up correctly, and they didn't necessarily have measures in place for inadvertently having staff that may not have been properly trained and clicking on links that they shouldn't. So this practice, unfortunately, one of their doctors clicked on a link that they shouldn't have, didn't tell anyone about it, and it let some malware in. That sat in the back of the system for a while, just sort of watching. And then one day it locked down the entire practice management server. None of the doctors could do anything. They lost not only the entire day's billings, but they also lost all of the historical information for a few months because the server wasn't backing up. They went to do the backup and found out, obviously, that it wasn't working. They had to pay, I think it was about $20,000 to the hackers to release the information. They thought that was pretty expensive and that they'd have to wait a little while before they could do anything to update it, but they didn't make any changes. The same software malware sat in the background and locked them down 2 weeks later. Had to pay another $20,000, but also there's all of the notifiable breaches. So had to notify the Information Commissioner and let them know that there'd been data breaches, and necessarily there were some fines that followed. So making sure that you have appropriate cyber risk management steps in place is incredibly important. Making sure that everyone part of the team knows exactly what they're doing and why they're doing it, and making sure that we're all being very cognizant of how to avoid those data breaches and those attacks potentially is really quite fundamental. As mentioned at the start, what we want to be doing to try and make sure that we're mitigating these risks as much as possible, obviously have a privacy policy so that every single patient and every person that comes through your practice knows exactly what you're collecting, why you're collecting, how you're collecting, and just generally what you're going to be doing with their information. You have to tell patients what all of those aspects right at the very outset of the relationship. So it's incredibly important that you do that appropriately. Make sure as well that if you are dealing with third-party IT companies, they have systems in place as well, or if you're otherwise sharing information with other people, that you're taking the right steps. You don't want to be one of those practices that potentially has a breach because they haven't taken the appropriate steps to try and protect the practice. I think the training is probably one of the best aspects that you're going to be able to lean on for your cybersecurity risk reduction and also just generally avoiding scams. So you don't want to be one of those practices where, as I say, you potentially send information to the wrong person because you haven't verified it, or you potentially share information to someone, maybe you send them their reports. We've had practices where they potentially send out to a husband a fertility test and say, good news, you're still fertile, you'll be able to have more children, but sent to the family email account. The wife doesn't realize that they were looking to have any more children. And lo and behold, there's a second family that's about to be started. So make sure you're confirming exactly who you're sending the information to, you know where it is going, you have their authority to send it to that specific address. And also look at potentially encrypting it so that there's a password to access records, so that you can make sure only the desired person is reading the content as well. Also, have a bit of a think about what your employment agreements actually say with your staff and with the doctors. I know at the moment, with a lot of concern around payroll tax implications, a lot of practices are looking to make their service agreements as lean as humanly possible. You should try and have within your service agreement with each of the doctors terms that really clearly outline what the obligations of the doctor are in the practice, because they're usually an independent practitioner. They're not necessarily going to be bound to your internal policies and procedures. So you should have within the service agreement really clear information around exactly what they're expected to do to maintain the privacy of their patients using your platform, what they have to do if they become aware of a data breach, what they have to do if they potentially cause a data breach, and how you're going to work collaboratively in order to try and resolve or mitigate the risks that may necessarily follow. Why is it important? I know it's kind of, well, hopefully it's a redundant question and you're all thinking, well, we know exactly why it's important then. But as you can see from that data, the health sector is the most targeted sector in Australia for cyber risks and cybersecurity and scams. So it's not necessarily a case of, Tracy and I just pulling it out of the hat and saying, well, this seems like a good topic to talk about. We know that practices almost on a daily basis having these potential cyber attacks. We get the emails as well where it seems really great. I think there was another one quite recently from CrowdStrike where it said, we're really sorry about the servers and the systems going down around Australia and worldwide. Here, click on this link and you can have a $25 voucher. That seems suspicious, and you want to make sure that your staff and your teams know, okay, well, I highly doubt this corporation is going to be sending me a $25 voucher when I'm not in charge of anything IT related or any contracts, so I probably shouldn't click on that link. Fortunately, lawyers have a lot of training as well, but it's part of making sure that yourselves and all of your teams are having the training as well to make sure that we're being more aware of these hacks and these potential scams. But also they're getting much smarter and they're getting much better. I've heard stories of certainly practices where doctors are telling the staff to update bank account details. It does happen all of the time, particularly when they know that there's high pressure and high stress, where if you have a doctor who's potentially constantly sending emails and someone's in their background saying, well, we can see this doctor likes to tell people, well, I'm too busy, can you just deal with this for me? That seems like the perfect person to say, oh, actually, I'll just come in and intercept one of these emails and potentially arrange for some of these medical revenue fees to be paid directly to my bank account. And if you have a doctor who doesn't necessarily check very regularly where those fees are going, there might be several payments before they become aware that they haven't actually been receiving their medical revenue. So do make the time and take the time just to be wary of all of these things. What should you do, or what is a notifiable data breach? So let's say that despite all of your steps for cybersecurity and to try and avoid scams, no fault of your own necessarily, one gets through the cracks and there is that data breach that occurs. So a data breach, unfortunately, is quite a broad term, and it can mean anything from, as I say, potentially sending an email to the wrong person, all the way through to completely having a compromise where your server's completely locked down and someone's taken control of it. So at the end of the day, what we want to think is, one, if you're not sure, talk to Tracy or myself or the Avant team, and we can help guide you through this process. But two, really what we're talking about with a notifiable data breach is where an individual's information is potentially compromised, and that compromise has the potential to cause some damage to them. So say it's quite a large gambit that it can potentially cover. And it's a fundamental aspect that you take steps as quickly as possible to try and remedy that, and bring it to someone's attention. So the worst thing you can do is have the data breach and sit on it and not tell anyone about it, not do anything. That's just going to cause yourself more issues in the future, unfortunately. Really, you want to investigate what's happened, try and prevent anything further from happening, and identify if it is a notifiable data breach, because then you have to notify someone. So it's a relatively straightforward process when you put it like that, but there's obviously a lot of things that happen in the background as well. That's a very quick hitchhiker's guide to cybersecurity and how to manage scams. If anyone has any particular questions or concerns, I'm more than happy to talk about them now. Otherwise, Tracy and I have some time for questions at the very end as well, and more than happy to take questions offline if you have anything. But otherwise, I'll let you take over from here, Trace.
Thanks so much, Ben. So I'm looking at the social media element of our presentation tonight. And so you can see, based on the data that we collated in December 2021, GPs are the highest users of messaging apps, which are classified as social media. So, and that's probably makes sense. Sorry, is someone trying to, yep. Because messaging apps and social media generally significantly impacts the way that medicine is practiced. Social media has the power to engage people in public health discussions, establish professional networks, facilitate access to health information and services, and it provides an easy and effective way to share information, and it allows medicine to be more accessible. It also enhances collaboration between colleagues, especially in remote or rural areas, or internationally. Colleagues based around the world can now communicate through social media on a much more immediate basis than ever before. So through social media, you can have an immediate and real-time interaction with a worldwide audience. You can also share your outcomes and create and promote content and raise public awareness about new and emerging health concerns in a very timely and directed manner. And this is particularly demonstrated through the pandemic, where social media was used to promote public health messages, which had to be disseminated quickly. Changes to mask policies and procedures for attending at practices when you had respiratory symptoms, all of that information was very quickly and effectively shared within communities through social media. It was also used to share public awareness for hygiene matters, like the importance of hand washing and covering your mouth when you cough. I mean, although these are very simplistic and common sense matters, the pandemic demonstrated how important they were and reminded us all that we had to abide by these small and important methods to control the flow of the illness. And so as issues change and become more important or less important, social media is the perfect tool to keep the public aware of those changes, and it can provide the answers to questions to the audience who needs those answers in a timely and effective way. It's also really important for collaboration between healthcare practitioners. You will all have your social media groups that you interact with, possibly on a daily or multiple times each day basis, so that you can share information that's relevant to you and interact in real time on those issues which are developing in your area of practice. It's also really important for those professional networks, and it gives you a forum to sense check your ideas, and as with COVID, when it was a developing situation, we had no information. Information was being gathered on a day-to-day basis. So it was a matter of information sharing through social media and community groups. It also provides a very important forum for people to interact in a safe space, and particularly for health practitioners, or indeed any group of practitioners, any industry. Social media provides you with a mechanism to interact with your peers in a way that provides you with some protection against concerns you might have about your career stage, or your gender, or your location, or any other barriers that you may have when you're standing in front of someone. They're not so apparent in a social media context. So Facebook and other forums like that provides a community space for conversations and indeed private support groups to foster supportive communications, particularly for medical students and the more junior practitioners. I don't know whether someone's trying to ask a question. Is someone asking a question? No? Someone's off mute?
Not that I can see. Sorry, Tracy, let me have a look.
Marianne, does she want to?
I might mute her because
there are birds.
She's muted. Yes. So sorry, Trace.
No problem at all. So they're the positive things with the social media, but there are risks, and those risks also attach to the accessibility and the immediacy of the platform. And that is because social media blurs the boundaries between the professional and the personal. And its accessibility means that the social media posts that you make in a personal capacity, or if you're in these communities of practice, you might say something that is said in a much less formal way than you would have done so if you were to certainly send a letter, but even an email would be perhaps more formal, because you would have in mind that an email would have to be put onto a file and kept, whereas the temptation is to see a social media message to be a much less formal and sometimes not a part of your professional practice. And that's the risk, because ill-advised social media posts can result in reputational damage in a professional sense. And that's not to say that you can't use social media if you're a medical professional, but you do have to be aware of the potential for crossover. And for those people on the call who aren't practitioners, but they are practice managers or they are part of the practice group, it's really important to bear in mind that that can also carry over for your communities of practice within your groups as well, because you can say things that are less formal, and then the risks are the same there. You'll see from the data on the screen, and that's again from our December 2021 member survey, that trainees and GPs are more likely to blur the lines between personal and professional identities on social media. And that is because you become a bit complacent, and you're also communicating in these forums not necessarily within business hours sometimes. So there is a relaxation of what you consider to be professional matters and personal matters, particularly if the people within those groups are your friends as well as your work colleagues. And that's where we find problems arise. So just keep that in the back of your mind. And when I give these sorts of presentations, people say, oh no, that would never happen to me because, you know, I'm very careful, and the people I talk to are my friends or my colleague or my, you know, my spouse, so no problem here. Yeah, there's problems sometimes that you don't foresee, but let's just keep that in the back of our mind. This is a really handy guide. It's from the AMA, and it's a guide to social media and medical professionalism. And it just poses a couple of questions, like, have you Googled yourself or posted about a work situation on social media? And that is within your medical students group. A lot of practitioners, certainly when they're based in the hospitals, have a working group of colleagues who communicate, particularly in WhatsApp groups or things like that. I imagine practice managers would have the same sorts of forums, and that's all fine. But as I was just saying, if you, let's say, put a circumstance into one of those groups, practice managers group, and you say, irate patient came in today, abused me, I'm sick of it, she's really a nasty person, comes in all the time, lives up the road, I'm sick of it. Okay, now you don't say who that is, but you've said lives up the road. A scenario might be that one of the people within that group knows the person who lives up the road from your practice, knows that they are a regular attender of your practice. In fact, it's their auntie. Knows that they've got a mental health condition that affects their ability to regulate their emotions, and they're going through a particularly tough time. They see your post. They don't know you particularly well. They're a member of your practice group, or your practice managers group rather. And they think, well, you don't know about my auntie, and that's a bit inappropriate for you to comment about her. And I can tell who that is from your comments, and you've breached her privacy. And that's how the situation evolves. And for a practitioner, well, let's say a practice manager, subject to your employment obligations, as Ben has just raised, whatever the rules of your practice are about what you can and cannot talk about, you've got confidentiality agreements and privacy obligations that you have to meet. You breach them if the person makes a complaint. If you're a medical practitioner, then the person whose auntie it is could make a complaint to the regulator. So you can see how the problem snowballs, and even though you haven't said a name, it's possible to get yourself in a difficult situation that at the very least causes you angst and difficulties at work. At the very worst, could result in an employment sanction, or depending on your profession or your role, some sort of explanation to another authority. So that's one element to it. The other element is, if you're a member of an online community, or let's say one of your colleagues is your friend on social media, Instagram, Facebook, whatever, and you say, but that's fine, I don't post anything of any significance, so it's no problem here. You can raise an issue even by liking a group that is controversial, or liking a comment that is controversial, or you know, it's not necessarily a direct comment from you that can lead to problems. It's the sensitivity of the person who's interpreting that comment, like, share, membership to a group, activity involving that controversial element, which is not to say that you can't have your own point of view, and you can certainly express it, but you need to be satisfied that whatever you do on social media, whatever membership groups or follows you have, you need to be comfortable that those aspects are an accurate reflection of the personal values that you uphold, and you need to safeguard that online reputation. And that's not to say that, you know, okay, no social media for me. Google might make a social identity for you. You might have no social media accounts, but you can still Google yourself and you can find your online profile, whether it's just your any references to you online. So it's something to be aware of and alert to. So as a guide, before you publish any post, you need to ask yourself, am I happy with that post or that membership appearing on a billboard at the front of your practice? And if the answer is no, don't do it. So Ben's covered off on the employment aspects of it. Particularly important, I know most of the people on the call would be within practices, but practices will have rules about comments. I would have thought, Debbie, there'll be some rules about what you should say in a public context. You certainly shouldn't say anything about a patient in a public context, but certainly if you work at a hospital facility or part of a health district, they have quite comprehensive bylaws that you need to be aware of. If you're a professional person, nurse, doctor, allied health, you will have a code of conduct, and that sits behind all of the obligations you have. And as a healthcare practitioner, you have to abide by the terms of the code of conduct. The national laws have a social media guidance, and that guidance says you can meet your obligations by complying with confidentiality and privacy obligations, complying with your obligations, your professional obligations under your board's code of conduct, maintaining professional boundaries, communicating professionally and respectfully with patients or colleagues or employers, and not presenting information that is false, misleading or deceptive, including advertising and that any posts are supported by acceptable evidence. So they're always sitting in the background, and that's where people can come unstuck for the reasons we just discussed earlier. The auntie up the road with mental health, that could be shown to be a breach of a privacy obligation for a practitioner if a report were to be made to a regulator. So as I said, you have the right to express your personal views and values, but you have to consider the effect of those comments outside of work insofar as they reflect on your role as a clinician and the reputation of the profession for those medical professionals who are involved on the call. So if you're a medical practitioner, you have obligations to meet the obligations under the Code of Conduct. And so the interpretation of certain views, if they're controversial, may cause issues in terms of those obligations. Also, I raised it earlier, you need to be careful what friends you choose online. You need to maintain boundaries and think about separating your online professional and personal profiles and content. Certainly don't extend friend requests to patients, and don't respond to friend requests from patients. Don't join their social networking groups. Don't interact in a social media context, because it will lead to problems. And particularly be really cautious about accepting friend requests, even on LinkedIn, from people you don't expect a friend request from or can't place them as someone you know, or someone you know certainly would be able to verify their identity in some other way. Because one, if it's a completely out of the box request, you can't verify their identity. It may well be a hacker or someone else who doesn't know you at all. But if it's someone you can't verify, there may well be links to others that you can't verify, and so that may well lead to a problematic situation. So I do have a case, and it's a bit more obvious in that it involves a junior doctor who was disqualified after harassing a colleague online. And in that case, a young practitioner was referred to the Civil Administrative Tribunal in Victoria for professional misconduct, on the basis that the board alleged that his conduct fell substantially below the standards reasonably expected of a medical practitioner, and that his conduct was also inconsistent with him being a fit and proper person to hold registration in the profession. In that case, the young doctor had met another young doctor in the context of their employment. They became friends. A year or so after they met and became friends, the young male doctor told the young female doctor that he had feelings for her. The young female doctor said that she did not reciprocate those feelings, and they stopped socializing together. Unfortunately then, the young male doctor continued to send harassing messages, and then later was charged with stalking and using a carriage device to harass the young doctor. So the young male doctor didn't involve any professional circumstances, that was outside work, and that was a personal relationship, but that person was found to have acted in a way that amounted to professional misconduct, and he was reprimanded and disqualified from practicing as a practitioner for 12 months. And the tribunal noted it was not a one-off lapse of judgment. It was not an ill-advised text. It was a targeted and planned harassment of the other practitioner via her mobile and also via social media, and that negatively impacted her ability to continue to work as a medical practitioner. So that wasn't related to work. It's more obvious in that it's clear, don't harass people, but there is the potential for your out of work activities to become a reflection of your professional activities. Moving on from there, never post any patient information on social media without specific consent, and that is specific consent to post, why you're posting, when you're posting. You would need to have the fullest consent of the patient, which would not likely be given. And then you would need to document that. And then you would need to get the patient to verify it. And that would have to be documented in clinical records, because any information that could identify a patient, it's going to be a breach of privacy. And that also includes any information that you won't even see to be obvious. It's the background information, or as I said, the lady up the road who is the auntie of the practice manager who's within the group. It happens in a way you will not foresee. And so you just have to be so very careful not to involve any discussion of work issues within your social media presence. For example, this happened, and so when cases like this exist, this was a post on Instagram. Luckily, you can't see the pixelated part, but when you have this conversation, people say it doesn't happen. Well, unfortunately, situations like that exist. And again, clinical images, they should only ever be taken for the purposes of the patient's clinical well-being. There should be an advantage clinically to taking the image, and it should be on the patient's file like any other medical record, and you should have the patient's consent to take that image. You should, if you're going to share it, it should be documented who you're sharing it with and why, and you need to document all of that. And certainly don't share it in any other way. Sorry, someone just took control of my screen. Advertising. You just have to be very cautious, and I don't know whether anyone's responsible for advertising, but you have to be very cautious about information not being misleading or have the potential to mislead. You can't use testimonials. You'll be aware of all of those matters. And also, you should make sure that you keep an eye on, if your practices have a web page, you need to keep an eye on it and just make sure that if it has the capacity for people to make comments, you need to keep track of that. Because even though you're not putting the comments onto the page, you wouldn't want them to be sitting there and for anyone to do an audit of the page to just suggest that that had been displayed as a testimonial. Reputational issues concerning Google reviews. We're contacted all the time about these sorts of things. Unfortunately, you can only ask that the comment be removed by the holder of the site, Google, or you flag the review. If you have that situation, you can contact our Medico Legal Advisory line to get guidance on that. You should never respond to the issue directly online. Certainly don't put any comments back at the page in the same circumstances as the post. If you wish to, you can seek further advice, but defamation proceedings are a very expensive and difficult proceeding to undertake. So it is a very difficult road. So unfortunately, a lot of people are not pleased when they get a Google review, but there is sometimes, aside from contacting the internet site, then there's not a lot to be done, but certainly it is made worse by responding directly to the person or responding defensively online. So, what's the link between social media and scams? Basically, scammers target, in the same way as the cyber breaches occur, the gathering of information is often incremental, and so information is not necessarily gathered from one source. It can be gathered over time, and as you've all been aware, the phishing attempts, the efforts that are made to undertake these scams are more and more plausible and less and less obvious. So it can be convincing, and you can be given information that looks as appropriate as any communication that you would expect. And so it can be very difficult, particularly if the timing is right. If it's 5 to 5 on a Friday and someone calls while your boss is away and says, the practice owner, Dr. Wilson, is in Geneva and they are stuck, and so I'm from the bank and they just want you to give me that authority, and they're stuck, so they just need that number. And so it's not going to be as obvious as that, but the timing, everything can come together and trap you. And the main thing is to not try as hard as you can not to be persuaded by the urgency of the situation and just act in order to have the matter resolved quickly, because you think that's what has to be done. Just take a step back and say, I'm just going to call you back in 1 minute because I have to, whatever, but just try and step back from the urgency. We published this article about a similar situation where a practice was tricked into paying a doctor's salary into a cyber criminal's bank account after they had emailed the practice claiming to be the doctor who worked at the practice. The email appeared to come from the doctor's primary email address, said the doctor had closed the bank account, provided newer bank details. Practice manager thought it was legitimate, updated the doctor's bank account details, allowed the Medicare payments to go into the criminal's bank account. The scam was only picked up weeks later when the doctor realised that they had not been paid, and the doctor raised a query with the practice. That money was gone, not recoverable. Cyber insurance doesn't cover practices for money lost associated with a cyber scam. Dreadful result for everyone. So it can happen so easily. And when you read some of these cases, the people involved are so embarrassed and absolutely horrified about their involvement. There has been no recklessness by the staff member. It's just been, unfortunately, one of those things where all of the circumstances have lined up to result in a terrible situation. So how can you avoid that? Well, we can all just do the best we can, but ID Care, which is Australia and New Zealand's national identity and cyber support service, says that scams cause breaches, breaches cause scams. Scammers don't discriminate. They come from all different age groups. They affect people with all different community demographics. Awareness and prevention is your best defense. Our security team suggests that you should always verify senders' email addresses for any inconsistencies. Phishing emails look similar, but if you just do the hovering and again step back, don't act immediately, and that's difficult because you're all fast-moving people and you've got 17,000 things on the boil at any one time. So it's just, and these things happen when things are banked up and you've got 7, 10 emails open on your screen, and you might even put it to one side and then you hit it and it goes. So you've got to check for incorrect spelling, different email domains. Don't click on links because it can be embedded in emails that can download the malicious software. Again, step back from the urgent requests or phone calls. Try and give yourself some space, even if it's to put the call on hold to get someone else involved. The panic and the sense of urgency can push you down a path before you have the ability to stop. Multi-factor authentication, I made that word up, special for tonight. Primary purpose of that, enhance security, mitigate risks associated with just passwords, and means that there's another way that you can protect yourself. And we also recommend consider geo-blocking functionality. Now this is way beyond my my technical abilities, but apparently some modern apps will allow practices to enable login restrictions based on geographical locations. So if you enable geo-blocking functionality, it can prevent hackers from logging into applications from locations that your practice hasn't permitted. For example, if you choose to restrict access to only allow logins within Australia, that means that international hackers might be prevented from gaining access. So, main messages from me: social media, be as careful as you can to separate professional and personal. Never, ever discuss work situations on social media, even if you don't use names. Don't use any discussion of work situations. Privacy can't be assumed, and any post or any comment can be screenshotted and presented in a way that is completely out of context and will be difficult to justify. You need to know the guidelines that apply to you. You need to know the employment obligations that apply to you. And with respect to scams, review your email addresses and just take a pause, and if you can, just talk to someone before you respond and act. So that's about it for me.